Hi everybody, this is Matt. We're going to continue our series on the peripheral vascular system, and today we're doing a special presentation on the liver. The liver is one incredibly vascular organ, and it is super important for many different reasons. Number one, it helps to remove toxins from your blood. It's essentially its primary role. So if it does not work well, those toxins stay in your bloodstream and affect many things, including your brain, and you don't want that. So to maintain the health of your liver, a few tips. Don't drink too much, because alcohol kills liver cells. Drugs, both prescription and non-prescription drugs, can build up in your liver and also affect its ability to function, and certain chemicals are prone to causing damage to the liver, and in excess they can cause the liver not to function well. So I just want to go into again the vasculature of the liver. And this is again Functionelle Anatomie from Berlin, and the pictures are just tremendous. So we're going to look at number 11, which is the hepatic artery, the liver artery, and number 13 is the inferior vena cava, and these are kind of the focal point of our presentation. So let me bring this in. You see number 11 there, and that is the hepatic artery, and that is in red. And I'll try to bring it right into the middle of the picture. So that's the arterial circulation of oxygenated blood to the liver. Now, number 13 is the inferior vena cava. And just as an aside, that green sac at the bottom of the liver is the gallbladder. And that is very important for the digestion of fat, and releases chemicals into your intestines to digest fat when you consume fatty foods. So back to the circulation. Very important to know, and I'll bring that up close. Look at the dense and complex nature of the vasculature of the liver. That is to reinforce its importance in the health of your blood, because your blood is really cleansed in many different ways by the liver. So some problems that happen when your liver becomes diseased. It, because of dead cells, becomes very tough and rigid, almost like leather. And that causes a lot of problems. Let's go back and look again at the hepatic artery, bringing oxygenated blood into the liver. If your liver is like a baseball glove, then you have the problems of having a lot more resistance of the blood flow into the liver being pumped to it by the left ventricle. Therefore, it can put a strain on your heart. And secondly, you will filter your blood less efficiently. And thirdly, backing up a little bit, looking at the inferior vena cava, what you have is essentially a stiffening of the entire organ, and that causes congestion within the liver. Fluids build up, and it causes the blood flow back to your heart through the inferior vena cava to be compromised. So anyways, that's that. And what affects a lot of the pressures going back to the heart and also the blood coming from the heart is that stiffness, such that you can have pressures build up retrograde or coming up towards your heart, and vessels that are prone to being weaker because of this increased pressure in liver disease caused by liver disease can cause bleeding. And some of those vessels are the weakest vessels are in your food tube, the esophagus. And people who have very, very severe liver disease frequently have problems with bleeding. One, because the bleeding factors, the coagulation factors, many of them are produced in the liver. So if the liver is diseased, it is not keeping that balance with the coagulation factors, and therefore the coagulation of your blood in check. So you're more prone to bleeding for that reason. And secondly, because your liver has become like a baseball glove, it's stiff, and the blood flow or the pressures in your circulatory system are thrown off and are increased. So if you have a break in one of those blood vessels and you don't have the coagulation factors to stop the bleeding, you can bleed to death. And that is the very sad end to many people who have liver disease, is that they bleed to death. And many of the factors relative to liver disease we can have some control over. And two of the biggest factors in destroying your liver are alcohol and drugs. And again, there are also prescription drugs that cause problems, but many of them are illegal drugs. So do yourself a favor, take care of your liver, and that way you'll be able to keep your blood clotting in order. You'll avoid these terrible problems with the buildup of toxins in your blood, which causes all kinds of problems, especially for your brain. And most of all, the chronic problems that develop because of liver disease are very unattractive, and you want to avoid them at all costs. But anyways, just the complex nature of the vasculature of the liver made it worthwhile to make this special presentation on the liver, and that is it for today. So have a great day.